All right, welcome back, everybody. We are here with a very special edition. I'm Kevin. You know me.
I'm Eva.
And I'm Thomas.
Very happy to have Thomas joining us today. So, we're going to talk about healthcare a little bit for you guys. The way I wanted to start this was to ask, do you guys think... Well, I'll phrase it like this. What country do you guys think has the best healthcare system?
So that really depends on the criteria you're using to judge best.
Okay. What do you mean by that?
So, do you want best to be like, I don't know, the cheapest? Do you want it to be the fastest? So...
Yeah. So there's a lot of different criteria we can talk about.
I think that, in my opinion, like what I value the most out of a healthcare system, America has. And so I would say that America is the best. Because outcomes-wise, we have very good outcomes, generally, especially like complicated things like cancer, different surgeries, that kind of things. And then as far as like pharmaceutical or innovative research or any kind of new like procedures, America is... I mean, there are definitely other countries who compete for the like things on the forefront, but I mean, especially like pharmaceutical and like new research, America is definitely leading. And also wait times, especially for like, let's say, I think if you're in another country, you'll always get in, let's say, if you have like a cancer or emergency heart surgery, I would say. In most countries, you're going to get in very quickly, but let's say you like tear your ACL or break your arm. There's I think those wait times, if you have the means in America, are going to be very, like much shorter on average than in a like more socialized medicine sense, even though like a lot of our medicine is socialized, I guess you could say.
So let's talk about the U.S. system for a sec, because I think that's worth kind of fleshing out. So the poorest Americans and elderly Americans have a public option, right? They are not really an option. They have a public service, right? Which is Medicare and Medicaid, right? Medicaid's for the poor, Medicare for the old. And most everyone else gets their insurance through their employers, and a small fraction buy their own insurance, but mostly everybody gets it through their employers.
You
right?
definitely want it through your employer, comparatively. But go ahead.
So if you look at like how much we spend per person on healthcare, it's like almost double that of all the other countries that you would compare with us. You know, the Germanys, the Japans, the Norways, all of our like rivals. We spend a lot more per person, for sure, way more than they do. And I do think you have a point that healthcare quality may be higher here. I would be slow and careful to say that our outcomes are better, because the average American is not really that healthy compared to like the average Japanese person or something like that. We smoke, we eat a lot, we don't exercise.
Definitely, I mean, I think obesity would be the number one. But that's almost a cultural thing versus... maybe outcomes are difficult to say.
So I think our care is probably the best in the world. If you have the money, for the best care that we have, it's the best in the world.
I even think if you have a poor person in another country and a poor person in our country, that the poor person here is still going to get the same quality, if not better care, than a poor person in any other country in the modernized world.
I think that is a little debatable, but I don't think that that's an unfair thing to say. I think it is up to interpretation and debate, but I don't think that that's inherently unreasonable or anything. But I don't know that our outcomes are like 2 times better than everyone else's, because that's how much more we're paying, right? Is like literally double what most countries pay.
Yeah, I definitely believe that.
So like, to me, I don't see that benefit.
So we're not like being efficient with our money, our healthcare money.
Yeah.
Or at least not as efficient as we should be to justify paying double. Maybe.
Yeah, for sure. Like, we're definitely... I think there is a lot of wasted resources because of the way our system is set up. Healthcare is a really hard one to address, right? Because, like, you want everyone to have access to it, and you want it to be really high quality. But it's kind of hard to have both of those things at the same time. Right?
Right. I mean, that is kind of the trade-off, it seems.
It's...
On some, I mean, a trade-off, it's definitely not 1-to-1, and I couldn't give you that ratio. And there does seem to be some kind of answer maybe in the middle, I mean, as with most things, but even in an employment-based system, there's, like, many flaws that if you lose your job, you lose your healthcare, obviously. But something I hadn't thought too much about until recently was, like, sometimes it is nice to have employer-based healthcare because those risk pools, I mean, they... the people who want health insurance, if there was no employment, would be the people who have the worst health, right? So there would be higher premiums charged. When you have something that forces you into healthcare, no matter that's outside of that health like sphere, like your job, there's no reason that your employment really is going to be tied to your health, right? And so like that risk, that levels out the risk a little bit more instead of just like pushing all the high risk people or people with pre-existing conditions or all these different people. You're going to have a much more like spread out group. So then like the whole insurance system can hopefully work a little bit better. So there are some like upsides to having it attached to your job. I don't know. There's another debate on if that outweighs the negatives, but...
So, I think if we're thinking about markets, right? Like we start with our basic kind of supply and demand models, and we work our way up from there. They are a little tricky when we apply them to healthcare, right? Because when you're making your healthcare decisions, you're often you're not acting rationally, right? You've just been hurt, you're in an emergency situation, and you're in
survival mode.
Right. And what did we say at the start of the semester? When you have a very short time frame that you need to make a decision on your purchase, what's that going to do to the price of the good, right? If you need something right now, I can't afford time-wise to go to another hospital. I need my leg stitched back on right now. Then if they say, this is what it costs, you're going to sign that. And you're going to say, all right, your demand is very inelastic,
yeah. And
right?
I mean, when you add in the fact that...
it's $10,000? Nah, I'm good.
When you add in the fact that all of that is behind a curtain that you might never see.
Right, and the prices are so...
there's no... You don't see a price.
I feel like they don't tell
you.
You
see a price.
Until afterwards.
Because you get a bill.
You get a bill. And they're pre-negotiated with insurance companies based on... I mean, who knows what factors... And so what market operates efficiently when there's no prices that can be observed?
Obviously, the market's not going to operate efficiently. Exactly. And I think if you look at the U.S. market, I get really bummed out by the healthcare system here. Because it's almost like we have the worst of two worlds, you know? Because the reasons you want free market is that you'll get higher quality stuff at lower prices. In food, in technology... This is pretty much always the case. If you let people make their own choices and make their own voluntary exchanges, you get good outcomes. But if you're gonna have a system like ours that is more free market than the rest of the world, generally, then we need to lean into it and let prices be visible and treat people like, instead of tying it to employers, we need to treat people like they're going to make their own healthcare decisions and let them choose their own doctors, let them choose their own, because that choice is what we get from capitalism that's good. So if we don't have all this choice, if we don't have all this voting with your feet, as we call it in the discipline, then what are we getting for the benefit from capitalism? And then on kind of the socialism, I guess you could say kind of loosely, into the spectrum, only the very poorest Americans and very old Americans are getting access to government health care. So, like, if we're going to dabble in both of these things, and we're not going to get those full benefits that these things give us, that these different ways of setting up your healthcare system give us, I can't see how we can expect to have good outcomes at low prices, and we don't. We just don't, and that's really frustrating to me.
So it was a poor compromise?
It's crony capitalism. It's crooked.
Yeah, to me, it's more about. I think it all kind of gets back to, and this is like even. I think insurance markets are, in this case, screwing everyone. The idea that there is no free market when you can have to pay triple the amount to go to somebody outside your network. And who is making sure that those doctors are in your network? Like, what incentives are they working off of? Are they working off of, however many people they get in the door? That's how they get paid. If you're working for, like the hospital insurance company, kind of like combinations sometimes, they work that way. That's a lot different incentive than just like, okay, as you do a more difficult procedure, then you get like more compensation based on how like intensive the care is.
It's very hard for a doctor to build a reputation in this kind of system, right? Because you don't choose your doctor. Almost nobody is choosing their doctor, right? So if you have a crappy doctor and you can't find another one in your town that's in your network with your insurance, what do? You just put up with it, right? That's no good.
You don't have many options.
That doesn't incentivize doctors to be better. And it doesn't incentivize hospitals and doctors' offices to be cheaper. We're really missing out on a lot of our benefits. And I don't think, just because the government pays for something doesn't mean that it can't be a free-ish market, right? Because if you look at some countries like Singapore, like Sweden, they are, certainly the government is paying for most of their healthcare generally. But they are using the free market to their advantage. I'll give you an example. In Sweden, you get a voucher. It's a kind of voucher system, and you get to take the money the government gives you and kind of pick an insurer company to insure you. And they suffer some of the similar problems that we do here, but not to the same extent. And it's much cheaper per person in their system than it is in ours. And Singapore, I also find to be a very interesting example. They have something they call a MetaSave program, and basically it's just health savings accounts for every person in the country. So you're required to save money for your health care. And obviously, young people, most people, generally aren't sick on any given day. They aren't using this money. They're just kind of leaving it set aside. And when they need it, it's there, and they've been required to save it. And there's also like safety nets for people that, if you get cancer or something, obviously you're not going to be able to pay for it with your savings. And the government has a safety net for those people in those positions. But Singapore has they put a lot of emphasis on having free markets in their insurance, in their doctors, because you get so many benefits from a good free market, but only if it's free. and only if there's choice and clear, rational choice where you know the price and you know the quality before you get into it.
Yeah. I think that would solve some of the problems on the healthcare side. I'm just not sure that it would solve anything on the insurance side. Because, like, let's say, like, what incentive does a young, healthy person have to get insurance? I would say there's almost none. It's, like, why would any college student, why would anybody who is generally healthy below 30, I mean, if you don't have a family, I mean...
Bless you.
And so clearly there's adverse selection in the market. And you clearly know more about your health than the insurance company does, you know? So...
Yeah, it's definitely a complicated issue. I would say that there are a lot of ways to do it. The U.S. has been really good at innovation, so a vast majority of new drugs, of new procedures are coming from the U.S. And a lot of people argue that that's why we spend so much more. And I do think that's pretty fair, because...
That costs money.
It's part. I think it is part of it. I mean, you can't run a regression and see how much of the variation is explained through, like, pharmaceutical
development
and research. But I do think there are definitely more incentives for pharmaceutical companies within the U.S. to have mass... I mean, if you do look at percentage of, like, gross revenue or revenues dedicated to R&D in your companies in the U.S. and your pharmaceutical companies in the U.S. versus other countries, there's much larger shares going toward R&D in the U.S. than other countries. And I think that is a function of... I mean, clearly a function of the profits that could be made. Because they know that once you have a drug, what do you have, 10 years? That you can charge whatever you want for it?
Right.
Something like that.
Patents,
if you patent it.
Patents are so messed up.
I'm
like
for
the way
that.
people use them.
I'm for that.
I feel like.
So, I have mixed feelings about patents. And I've mentioned this in class before. Like, there's benefits to patents, clearly. Like, you want to incentivize innovation. But there's a trade-off there. Because the more you incentivize innovation through patents, you also create this world where someone has absolute control over an idea. And an idea can be, a chemical recipe to create a pill that'll do whatever, save lives. And we want people to invent new pills to save lives. But we also don't want people who need their lives saved to not be able to get it because of money, right?
Yeah, I think it's clearly a trade-off. I just think, I mean, I don't want to say that I think, in general, for those people who are thinking rationally, is it in their best interest? They're going to put it at a point where a lot of people are still able to get it, right? Where, I mean, at an equilibrium, where the price isn't $1 billion for a pill to cure cancer. It's going to be a lot of money, for sure. But they still want to price it to where a large amount of people are going to be able to buy it so that they can maximize profits. And I'm also not saying that there aren't people who aren't able to pay. But I still think if they're working in their best interests, then a lot of people are going to have access to an amazing drug. And clearly that doesn't, like, monopolistic markets work in different ways. Even then, I think I would take the trade-off in the innovation than versus, like, not as much innovation and more people getting care, I would say. But that's just a personal opinion of kind of where I am on. I think that's kind of like a pretty American thing to say or believe.
So, to some extent, to kind of sum it up, I would say, is the U.S. the best healthcare system in the world? Maybe. It depends on which way you're trying to measure it. If you're measuring it based on which healthcare system innovates the most and creates the most new medicine and the most new procedures, yeah, we're definitely the best in the world at that. But if you're gauging which healthcare system in the world has the most access at the lowest cost, it's definitely not us, right? So
And quality is a even harder discussion.
yeah, quality is hard because there's
because
so many.
and at different levels and at different places. I mean, if you look at like quality in the south side of Chicago versus the nicest place in Louisville,
Or quality for
it's gonna
like
be
daily, like normal routine things, and then quality of care for like when
Like,
you have a heart
you have
attack.
right.
So how do you measure quality though? Because if you're saying the quality of our heart attack medicine is the percent of people that have a heart attack and live. Well, there's so many variables that go into that aren't the healthcare system.
And we
Yeah.
know that Americans
That's
are.
true.
I mean, what if we're doing the exact same as every other country, but Americans are like this X amount of percent of like there are way more Americans that are obese, and we know that like causes even more complications. So maybe we are actually having better outcomes, but we're just way
So unhealthy that we can't see them.
right. Exactly.
That's
We don't get
sad.
to reap those benefits because everybody here is overweight.
All right. Well,
Man.
I mean, I don't mean that not in a bad
No,
way, but I mean,
like-
statistically compared to other countries, we are. I
Yeah.
mean, like Singapore, yeah, for sure we are.
I mean,
comparatively.
yeah.
Huh.
But anyway,
It's a complicated issue. There's nuance, and I think rushing to the side of
We're the best. We're the worst.
right
Isn't
to
really-
to try and rush and say this is the way we should do our healthcare system, and to try and rush and say we need to flip the table and institute a single payer. I don't think that either of those are really
and there's one thing for sure is that
Ideal.
it's definitely not perfect by any means or anywhere close to it. And there's a lot of things that could be improved. So
Yep. All right. Well, that's pretty much a wrap on that. Thanks for talking with me, guys. All right.
Thanks.
Catch you later.